Hello, YDI colleagues. We made it through day one of our modified service delivery model. By the end of the day yesterday, we learned more from you, from our parents and our clients, and from state and national leaders and healthcare professionals. The President indicated that this virus emergency might not end until July or August. He also indicated that his team has discussed extreme measures like a complete lockdown similar to what is occurring in Italy and Spain right now and other places, or shelters in place as is happening in San Francisco as of this morning. The President is not ready to do anything at this point, but each day is new. And locally, we have some people saying that schools might not open again this year. So we're preparing for whatever comes at us. We appreciate your flexibility as we work together during these very, very difficult times. Our funders, including Head Start, have given us assurances that we can continue to pay our staff, but all funders have indicated that they expect some type of continued support to parents, families, and clients. We're all blessed that we will continue to be paid for our salaries. From you, we have learned some things too. We've learned that there are challenges of working from home and caring for children or being a caregiver, and it makes it difficult to implement what you heard from your supervisors and managers. So we will continue to clarify those expectations, but we will do it through a framework of balancing parent, family, child needs with your needs as staff. For us here at YDI, our driving passion to support our parents and our families, our clients, helps us to find ways to continue to interact and to support them. But that same passion sometimes makes it difficult to balance our own personal and our family's needs with those of the people we serve. So in the spirit of balance, your leadership team has agreed to the following. We are expecting that we will support those we serve through an empowered and cooperative staff. That's you, an empowered and cooperative staff. We're empowering you to determine the level of interaction your parents, your families, your clients need to continue to feel supported. We know that you have and will always have their best interests in your heart. During this critical time, your contact might be the most assuring contact that our clients get. For some, a call once a week might suffice. Others might need a daily check-in, and some a quick text. Some might want to talk to you on a Saturday morning, others on a weekday evening. Some of you serve the same person and family, and you could share the work. Some clients need little interaction, and others need a lot of interaction. So continue to talk to them, continue to involve them in determining what they need. But do this within the context of balancing your family needs and safety. Your work during this time is not defined in terms of time or place of service, but appropriate documentation of services is needed. We can all learn from this experience as we define our success in the future. Supervisors, the same empowerment goes to you in continuing to support the staff you supervise. Stay in contact with them. Help them in their efforts to support their parents, their families, their clients, and help them in taking care of themselves and their families. So what we've instituted to address some of the concerns you've shared is an individual hardship request. Those of you that are taking care of children or grandchildren or are caregivers of others may have a harder time completing your expectations. Those of you that are part of a vulnerable population or care for someone in a vulnerable population should plan to work from home as much as possible. We are defining vulnerable populations as anyone with an underlying health-related issue, especially if age 60 or older, and staff 60 or older. Discuss your personal situation with your supervisor. We're defining these requests as an individual hardship request so that we can document as needed. Be prepared to explain why you need this type of approval. Please send an email with your request and follow up with a call to your supervisor. Supervisors will be flexible in approving these types of requests. They should consult with their directors or vice presidents if needed. Supervisors, you're also eligible for a hardship request. If any individual staff member chooses not to work during this time, follow the hardship request process and request sick or annual leave. But please note that this is an individual decision, which may mean that you might run out of leave in the future. YDI will not cover you if you run out of leave in the future. We will cover leave for employees that are sick with the coronavirus and those who are quarantined due to a family member who is sick and quarantined. During this time, we want you to take care of yourselves, so personal care and exercise are important. Your schedules might have more time and flexibility than usual, so I urge you to find time, 30 minutes a day if possible, to exercise your body and your mind. Play with your children, go for walks, read to and with your children. Teach your older children how to cook, things like that. Please practice social distancing and be vigilant for symptoms of the virus. Please help to communicate, especially to our youth, the importance of protecting older and more vulnerable populations. And stay home as much as possible. And please remember that there are meal sites where your children can receive food. Those of you that work for Amistad, Casa Hermosa, and the Neutral Corner, you also will have a different situation. You will have different expectations due to the type of work you do and the expectations of our state. Your supervisors will communicate those expectations to you. You are also eligible to submit an individual hardship request. But due to the nature of the facilities and the expectations of the state, the hardship request may be addressed differently than other staff. And WIOA staff, we are still trying to understand where the WIOA program is in terms of these situations. Currently, WIOA staff are expected to follow the direction of the office that they are housed in. Please communicate with your supervisor, the AE, and the operators, and those in your workforce office. We will continue to communicate with WIOA leaders, especially about our hardship request process, as well as clarity about working from home. We hope that this message provides clarity as to how we will progress during this most difficult time. However, as the situation progresses, we can expect changes. They are happening every day, these changes. And as these changes occur, we will continue to communicate with and to you. Together, we will get through this. Let's take care of ourselves and our families while still sustaining support to those we serve. And finally, I'm including information sent out from the governor's office that is helpful in understanding this situation. Please share this information with your family, your friends, and with those we serve, our clients. I'm going to share this with you, but you will also find it in the email, so don't expect that you have to write down all these phone numbers. But New Mexicans who report symptoms of the COVID-19 infection, the coronavirus, such as fever, cough, or shortness of breath, remember that. Fever, cough, or shortness of breath should call their healthcare provider or the New Mexico Department of Health COVID-19 hotline immediately. That number is 1-855-600-3453. People without those symptoms do not need to be tested for COVID-19. This is allergy season and many of you have allergies. And allergy symptoms such as sneezing or itchy eyes, nose, or throat do not indicate a need for testing. While the state is gratified that this testing is increasingly available, we need to prioritize it for persons with symptoms. Remember the symptoms of this infection: fever, cough, or shortness of breath. If you have non-health related questions or concerns, you can also call 833-551-0518 or visit newmexico.gov. That website is being updated and finalized as a one-stop source for information. The State Department of Health is updating its dedicated COVID-19 webpage, which is cv.nmhealth.org. So please, take care of yourselves. Practice social distancing. Stay home if possible. And thank you for continuing to support those people that count on us each and every other day. Thanks. Bye-bye.